Thank you, Mr. Williams, and good afternoon to everyone. We have been rolling out or administering the COVID-19 vaccines for almost 1 year. And to date, we have achieved the following coverage rates. 82.1% of the adults in our population have come forward and accepted the first dose. 76.6% of the adults are fully vaccinated. And we are happy that 8.5% of the adults in the population have come forward and requested their booster shot. So 8.5% of the adults are boosted. In terms of the teenagers, 12 to 17 years, 18.1% of children in this age group, they have received the first dose, and 15.8% are fully vaccinated. Now, this slide shows the data, the vaccination data disaggregated by island, but it's important to note that when we look at the total population, 55.3% of the entire population in the Federation are fully vaccinated. That's an achievement, but we still have work to do. We have a 45% of the population still to come on board in terms of being fully vaccinated. Now, this slide shows that over this past week, we've added 115 newly diagnosed cases of COVID-19. Last Wednesday, that previous week was 305 cases. This week, it's 115. So, ladies and gentlemen, the numbers, the daily count is going down, and we are happy for this. Now, in terms of the recovered cases, over this past week, we have identified 322 cases who have fully recovered from COVID-19, and for this we are thankful. This shows the epi curve, and we are on the other side of the curve. The cases peaked in the earlier part of January, the first week in January, and I think round about the 20th of January, that's when we saw the peak in terms of the total number, the highest number of persons recovering in any one day, over 300. And that was around the 20th of January. And so we are doing quite a good job in terms of containing this fourth wave of COVID-19 infections that started Christmas Eve 2021. Now, during this wave, we added a total of 2,624 cases. We have had 2,295 of these cases recovering. And so currently, the case managers, they are monitoring 342 active cases. Now, over this past few days, we've added 9 COVID-19 related deaths. And I'll share a little bit more about these cases of COVID-19 related deaths. Before doing so, I want to speak about recovery, just sharing some data that came out in our HEOC meeting this morning. If you are fully vaccinated and you've been diagnosed with COVID-19, the average time to recovery is approximately 7 days. If you are unvaccinated, the average time to recovery is approximately 12 days. But based on the data, we are noticing that persons who are fully vaccinated, if you have underlying chronic conditions like diabetes, you may experience a longer time to recovery. And it's the same, or it's similar in terms of those who are unvaccinated. If you have underlying chronic conditions, when we test to see if you have recovered, it usually takes a little longer than 12 days. Now, in terms of the the 9 recently reported COVID-19 related deaths, it's important to note that these individuals were all unvaccinated. They were older adults and they had underlying chronic conditions. WHO says that older persons with underlying chronic conditions, they are experiencing an elevated risk of severe COVID disease. That means these individuals are at an increased risk of being admitted and going on the ventilator and even dying. So unvaccinated persons face a higher risk of becoming severely ill. Vaccinated individuals, on the other hand, generally experience mild illness, and those who do have breakthrough infections, they just have mild symptoms. In 1 or 2 days, they recover without much problems. This may be repetitious, but it's important for me to underscore that the most vulnerable persons amongst us at this time are the older adults who are unvaccinated and who have underlying chronic conditions. And so when I look at the demographic information about the persons who recently died, I realized that these individuals weren't going out regularly. They didn't go out and pick up COVID or Omicron. Based on the information we have, what we are surmising is that these individuals picked up the infection from their loved ones, from persons in their social network. So their children, their grandchildren, nieces, nephews, sons, daughters are the individuals who brought COVID home to them. They succumbed to the illness. And so we want persons in families, in social networks, to be careful when interacting with the older adults in your social network, especially those older adults who are unvaccinated. Because if they do become ill, their risk of getting severely ill, their risk of being admitted is high. This slide shows or highlights the current situation. So to date, the Federation has reported a total of 5,446 confirmed cases of COVID-19, and 5,067 of these cases have fully recovered. We are monitoring 342 active cases as we speak. And the total number of COVID-19 related deaths over the entire period of the pandemic is 37. 6 reported for Nevis, 31 reported for St. Kitts. Just some additional data regarding the 37 persons who have passed. In terms of their gender, 2/3 were male, 1/3 about were female. 89% of the individuals who died from COVID were unvaccinated, and they were mainly older adults. 78% of the individuals were over 60. And so this is very important. Again, we want to pause and reach out to those individuals who have not yet come on board in terms of accepting the vaccine. I want to implore you, I want to, I'm beseeching that you recognize your vulnerability, empower yourself with the latest information about the vaccines, and recognize that the vaccines do provide that layer of protection, and it helps you to combat this virus. Some persons are saying Omicron just causes a mild disease and they will take their chance. But I don't want us to become nonchalant and, take this new variant for granted, because there are individuals who have become seriously ill, even with Omicron. And we get the testimonies daily. Those individuals who have gone through the experience and who have recovered, they tell you that, they are happy that they made that decision and took the vaccine because it gave them that fighting chance, that layer of protection that helped them to overcome and recover. Long COVID. So yes, those persons who have been diagnosed with COVID, they are very happy when they get that call saying that their recovery test is negative and they are recovered. However, there are some persons who have had that call, gotten that call. They go on to describe symptoms, long-standing symptoms, or what we deem long COVID. Some of these symptoms include malaise, fatigue, brain fog, just to name a few. Now, long COVID has been a challenge as health entities and countries have different practices and requirements for making the diagnosis. So in the United Kingdom, for example, you have to be experiencing or complaining of some of these symptoms for as long as 3 months before you are diagnosed with long COVID, whereas in the United States of America, in about 4 weeks. If these symptoms persist for a month, the diagnosis may be made. All persons who have had COVID-19, whether they were hospitalized or may have only had mild symptoms, you can experience long COVID. So what this is really saying is that even persons who just had mild symptoms, maybe chills, fever, a little fatigue for about 3-4 days, and you may have recovered, you can still go on to experience be diagnosed as having long COVID. So COVID is not as simple as some persons are making it out to be. Studies have shown that even mild cases of COVID-19 can trigger persistent symptoms, and individuals can be impacted by COVID for 6 months, even a year after getting that negative test result saying that you have recovered. Now, long COVID can happen no matter what virus variant occurs, and there's no evidence that there's any difference between Delta, Beta, or even now Omicron. Omicron came to the fore in November of last year, so not enough time has elapsed for the scientists to say emphatically, what are the signs and symptoms of long COVID secondary to Omicron. Now, although getting vaccinated significantly lowers the risk of developing long COVID, reinfection may cause a flare-up in symptoms. So it's important to note that. It is too soon to know, scientists say, but mild initial illness may not signal reduced risk. So yes, let me just repeat. So if you were diagnosed with COVID during this 4th wave, which would be due to the Omicron variant, if your symptoms were mild, yes, there is a lower risk of developing long COVID, but there is still a risk of you experiencing persistent symptoms. The scientists are still, monitoring individuals to determine what your experience will be like, but there is still a risk. So ladies and gentlemen, we cannot take Omicron for granted. We cannot be nonchalant about it. We need to do all we can in terms of prevention and control. And so preventing COVID, preventing your risk of exposure to Omicron is still very, very important, particularly in our older adults who are unvaccinated and those with underlying chronic conditions, which includes diabetes and stroke or cerebrovascular accidents. Now, last week I shared some information coming out of CDC whereby we are told that children who have been impacted with Omicron they are showing an increased tendency of developing diabetes. And so that is one reason why, parents and guardians need to really consider and provide consent for children between the ages of 12 to 17 in terms of being vaccinated. Getting more young school-age children vaccinated is crucial for ending this pandemic. Public health officials say that persuading parents to get their younger children vaccinated is crucial, not only to sustaining in-person education, but also to containing the pandemic overall. Because just think about it. Once your son, daughter, niece, nephew leaves home to go to school, they are exposed during the trek to school. They are exposed during the break time, during lunch break, while even in the classroom. And so give your child that added protection, that added layer of protection through vaccination. So there are many reasons why you really should consider providing consent for your child to be vaccinated. The vaccines are there. Those 12 to 17-year-olds, they are eligible. Last but not least, we want you to wear your face mask at all times when in the public places, like you're going to the bank, going to a restaurant. Yes, when you're not eating and drinking, going to pay your utility bills. And if you're going to a family gathering, we want you to maintain adequate hand hygiene. If you are, if there is an exchange or transfer of, paper, whatever it is between yourself and another, you make sure to sanitize your hands before and after. And maintenance of that adequate distance between yourselves and others, very important. And there are a number of individuals who are experiencing COVID-like symptoms, and they are still going on the bus, public transport with others. They are still going to work. And there are some children who are experiencing COVID-like symptoms, and they are still being sent to school. Ladies and gentlemen, if your child is experiencing any of the COVID-like symptoms, please have them remain at home. These symptoms include fever, chills, aches and pains, unusual aches and pains, a cough, shortness of breath, just to name a few. Some complain of vomiting, even diarrhea. These are some of the main complaints of persons impacted by COVID at this time. So if you are experiencing any of these symptoms, you need to really remain at home and seek medical care and get tested. We end on that note. Thank you.